I'm about to reveal the 3 specific vitamins that act as natural keys to help lower your blood sugar and restore your body's control over its internal energy. Many seniors living with diabetes feel a constant sense of frustration as they watch their numbers climb despite their best efforts, and you might not even realize that a simple, silent deficiency in these 3 nutrients could be the invisible barrier standing between you and steadier readings. It is common to believe that diet and medication are the only tools available to you, but as a doctor who has monitored thousands of laboratory results, I have seen how missing just one of these foundational elements can leave your system struggling to process sugar efficiently. I remember a man named Harold, who was 72 years old and felt a deep sense of defeat because his morning blood sugar numbers remained stubbornly high every single day. He was experiencing persistent fatigue, a strange dryness in his mouth, and a heavy feeling in his legs that made his daily walks feel like a chore. His previous doctors might have been telling him to simply keep doing exactly what he was doing and wait for the medication to work, but they were overlooking the fact that his body lacked the basic cellular tools needed to actually use the insulin he was producing. 1. Take a vitamin D3 supplement with your morning meal. The very first thing you should do is start taking a high-quality vitamin D3 supplement every single morning alongside your first meal of the day. This specific vitamin functions more like a hormone than a simple nutrient, acting as a physical key that helps unlock the tiny doors on your cells so that sugar can leave your bloodstream and enter the cell where it belongs. When you have enough of this vitamin in your system, your body's natural insulin works much more effectively, allowing your sugar levels to remain much steadier throughout the afternoon and evening hours. I remember a woman named Alice who was 69 years old and struggled with blood sugar spikes that seemed to happen for no reason at all. Her primary mistake was staying indoors most of the day and never checking her nutrient levels, which left her severely deficient in the very tool her cells needed to recognize insulin. We corrected this by adding a daily vitamin D3 supplement to her morning routine, ensuring she took it with a small piece of healthy fat to help with absorption. Within just a few weeks, her daily readings became remarkably more predictable, and she felt a renewed sense of physical energy that allowed her to enjoy her grandchildren's visits without needing to sit down constantly. When your vitamin D levels are too low, the receptors on the outside of your cells become deaf to the signals that insulin is sending, which causes sugar to back up in your blood like a traffic jam. Taking this vitamin helps to repair and sensitize those receptors, making it much easier for your body to move sugar into your muscles and organs where it can be burned for fuel. A recent clinical study followed a large group of seniors and found that those with optimal levels of this specific vitamin had a much easier time maintaining healthy, stable sugar readings over the long term. Because vitamin D is fat-soluble, it is vital to take it with a meal that contains a little bit of healthy oil or fat so your body can actually pull it into your system. To do this properly, look for a vitamin D3 supplement that uses a vegetable-based or halal-friendly capsule to ensure it aligns with your dietary needs. Take 1 dose every morning as you sit down for breakfast, swallowing it with a full glass of plain water to help it move comfortably through your digestive tract. You should make sure your breakfast includes a small amount of healthy fat, such as a few slices of avocado or a teaspoon of olive oil, to ensure the vitamin is fully absorbed into your bloodstream. This simple morning habit provides your cells with the foundational support they need to manage your sugar levels more effectively for the rest of the day. 2. Add vitamin B1 in the form of benfotiamine to your routine. You should consider adding a specific form of vitamin B1 called benfotiamine to your daily routine to protect your delicate tissues from the hidden effects of elevated sugar. This unique fat-soluble version of the vitamin is specifically designed to reach the tiny, fragile blood vessels in your eyes, kidneys, and toes that are often the most vulnerable to damage when sugar levels remain high for too long. By maintaining high levels of this nutrient, you provide a protective shield for your nervous system, helping to prevent the uncomfortable tingling and numbness that many seniors with diabetes experience in their hands and feet. I treated a 74-year-old man named Arthur who was deeply concerned about the strange pins and needles sensation he felt in his toes every night when he tried to sleep. His main mistake was relying on a standard multivitamin that contained very little of the specific B vitamins his nerves actually required for protection. We corrected this by introducing a daily dose of benfotiamine, which allowed the protective nutrients to stay in his system much longer than standard water-soluble vitamins would. Soon after making this change, Arthur reported that the uncomfortable tingling in his feet had quieted down significantly, allowing him to sleep through the night without the constant distraction of nerve pain. When blood sugar is elevated, it can create a type of internal rusting in your smallest blood vessels, which slowly starves your nerves of the oxygen and nutrients they need to stay healthy. Vitamin B1 acts as a powerful cleaner for your metabolic pathways, helping your body process sugar through a safer route that doesn't create as much internal stress or damage. Because benfotiamine is fat-soluble, it can actually enter the fatty protective coating around your nerves, providing support exactly where it is needed most. This specific form of the vitamin stays in your body for a much longer period than regular B1, providing a consistent level of protection for your eyes and extremities throughout the entire day. Look for a supplement specifically labeled as benfotiamine at your local health food store or pharmacy, ensuring the label does not list any prohibited animal-based additives. Take this supplement once a day, preferably at the same time as your other morning nutrients, so it becomes a steady and reliable part of your daily health ritual. It is best taken with a meal to prevent any potential stomach upset and to help it travel efficiently through your digestive system. Providing your nerves with this specific type of protection helps ensure your long-term comfort and mobility as you continue to manage your health. 3. Take a vitamin B12 supplement if you use standard diabetes medication. It is vital to take a daily vitamin B12 supplement if you are currently using common medications to manage your blood sugar. Many of the most frequently prescribed treatments for diabetes can silently interfere with your stomach's ability to absorb this essential vitamin, leading to a hidden deficiency that causes deep fatigue, memory fog, and physical weakness. By proactively replacing this nutrient, you can often resolve the false fatigue that many people mistakenly blame on their age or their diabetes, when the real culprit is simply a lack of this specific energy-producing vitamin. I remember a woman named Gloria who was 70 years old and felt so physically weak that she struggled to walk even short distances without feeling completely out of breath. She assumed her exhaustion was just a side effect of her condition, but she didn't realize that her long-term medication was slowly draining her body's stores of vitamin B12. We corrected this by adding a sublingual vitamin B12 supplement, the kind that dissolves right under the tongue, to her daily routine. Within a few weeks, the fog in her mind cleared away, and she felt a dramatic return of the physical strength she thought she had lost forever. Vitamin B12 is absolutely essential for the health of your red blood cells and your entire nervous system, acting as a primary spark for your body's energy production. However, some medications change the environment in your stomach, making it nearly impossible for your body to extract B12 from the food you eat, such as eggs or dairy. When your levels drop too low, your red blood cells can't carry oxygen effectively to your muscles, which is why you might feel tired even if your sugar numbers look relatively stable. Supplementing with this vitamin ensures your body has the raw materials it needs to maintain a sharp mind and strong muscles regardless of the medications you are taking. Choose a vitamin B12 supplement in the form of methylcobalamin, which is the version that is easiest for the senior body to use immediately. For the best results, many people find that a sublingual tablet, one that you place under your tongue and allow to dissolve completely, is much more effective because it bypasses the digestive issues that often cause the deficiency in the first place. Take this once a day in the morning, and you will likely find that your daily energy levels feel much more consistent and reliable. This simple addition ensures that your efforts to manage your blood sugar don't come at the expense of your daily vitality and mental clarity. 4. Test your blood sugar levels exactly 2 hours after you finish your morning vitamins and breakfast. Checking your numbers at this specific time allows you to see exactly how your morning routine and your new supplements are helping your body process the energy from your meal. I remember a man named George who was 66 years old and felt very discouraged because he thought his vitamins were not making any real difference in his daily health. He was making the common mistake of testing his sugar at completely random times throughout the day, which provided him with very confusing and inconsistent information that made him want to stop his routine entirely. Once we corrected this by having him test exactly 2 hours after his breakfast and vitamins, he finally saw a clear, steady improvement in his numbers that gave him the confidence to stay consistent with his healthy new habits. When you eat your breakfast and swallow your morning vitamins, your digestive system starts a very carefully timed process of breaking down that food into glucose for your cells to use as fuel. It takes a specific amount of time for the vitamins to travel into your bloodstream and start their important work of helping your cells open up to receive that sugar. If you test your blood too early, you might only see the temporary rise in sugar from the food you just ate. But if you test exactly 2 hours later, you are seeing the final result of how well your body and your vitamins work together. This specific measurement is one of the most important tools you have because it tells you exactly how effective your morning choices are at keeping your system in a healthy and stable balance. To do this properly, place your blood sugar testing kit on the kitchen counter right next to your vitamins so that you see it as a gentle reminder every single morning. As soon as you finish the very last bite of your breakfast and take your final vitamin, look at the clock on your wall or set a simple timer on your kitchen stove for exactly 120 minutes. While you are waiting for the timer to go off, make sure you do not eat any other snacks or drink any sweet juices that could change your results before you have a chance to measure them. When the timer finally rings, sit down in your favorite comfortable chair. Wash your hands thoroughly with warm water and soap to ensure your skin is perfectly clean, and perform your test as you usually do. Write this number down in a dedicated notebook so you can look back and see the steady progress you are making over the coming weeks. This simple habit supports much steadier readings and gives you the clear evidence you need to know that your hard work is truly paying off for your long-term health. 5. Take a gentle 10-minute walk immediately after the meal where you take your vitamins. You should make it a priority to take a short, gentle 10-minute walk immediately after you finish your breakfast and take your morning supplements. Moving your body in this way uses your large leg muscles to naturally pull excess sugar out of your bloodstream, which provides an immediate boost to the work your vitamins are already doing at the cellular level. I remember a woman named Sarah who was 70 years old and noticed that her sugar numbers often stayed higher than she liked for several hours after her morning meal. Her mistake was immediately sitting down in her recliner to read the morning newspaper right after eating, which allowed the sugar from her breakfast to sit in her blood without being used for energy. We corrected this by having her take a very brief 10-minute stroll around her living room and kitchen before she sat down to read, and she was amazed to see her post-meal spikes disappear almost immediately. Think of your vitamins as the key that unlocks the door to your cells, and your gentle walking as the person who actually pushes the energy through that open door and into the muscle. When you stay completely still after eating, your muscles are resting and do not require much fuel, which means the sugar stays in your blood, even if your vitamins are trying to help it move. By simply standing up and walking for just 10 minutes, you are sending a physical signal to your body that it needs to start burning that fuel right away. This does not require any heavy lifting or fast movement. Even a very slow and easy pace is enough to tell your system to start lowering the amount of sugar currently circulating in your veins. To incorporate this into your day, finish your breakfast and take your vitamins while you are still standing in the kitchen or immediately after you get up from the table. Instead of going straight to the couch or your favorite chair, keep your walking shoes on and move gently through your house or step outside for a breath of fresh air if the weather is nice. Walk at a pace that feels completely comfortable for you, making sure you can still breathe easily and hold a conversation without feeling any strain or physical stress. You can even use this time to do very light chores, like putting away a few clean dishes or tidying up a counter, as long as you keep your body in constant, gentle motion for the full 10 minutes. Once your time is up, you can then sit down and enjoy the rest of your morning, knowing you have already done something powerful to help your body manage its energy. This simple same-day lever is one of the fastest and most effective ways to see a positive change in your daily blood sugar numbers. 6. Swallow your daily vitamins alongside a small slice of avocado or 3 whole olives. Always make sure to take your morning vitamins while eating a small serving of a healthy fat, such as a thin slice of fresh avocado or 3 whole green olives. Many of the most important nutrients for blood sugar, especially vitamin D3, are fat-soluble, which means your body physically cannot absorb them or use them unless there is a little bit of healthy oil present in your stomach at the same time. I treated a man named James, who was 75 years old, and had been taking his vitamins on a completely empty stomach for years because he thought it would make them work faster. He was frustrated because his blood tests showed he was still very low in key nutrients, despite spending money on supplements every month. We corrected this by having him eat his vitamins in the middle of his breakfast along with a few slices of avocado, and his very next blood test showed that his nutrient levels were finally where they needed to be. If you swallow your fat-soluble vitamins with only a glass of plain water or on an empty stomach, they will often pass right through your digestive system without ever being absorbed into your blood. It is similar to trying to mix oil and water. The vitamins need a carrier made of healthy fat to help them pass through the walls of your intestines and reach your cells where they can do their work. Avocado and olives are perfect for this because they contain very clean, natural oils that support your heart and do not cause your blood sugar to rise. By providing this small amount of fat during your meal, you are ensuring that you get the full benefit of every single supplement you take, rather than letting them go to waste. To do this correctly, prepare your breakfast as you normally would and add 1 or 2 thin slices of ripe avocado to the side of your plate or put 3 plain olives in a small dish. When you are about halfway through eating your meal, take your vitamins and swallow them with a sip of water, then immediately eat the avocado or the olives to ensure they all mix together in your stomach. Make sure the olives you choose are plain and not filled with any heavy salts or processed ingredients that could irritate your stomach or interfere with your health goals. This small and tasty addition to your breakfast ensures that your body has exactly what it needs to pull those vital nutrients into your system so they can start helping your blood sugar right away. This simple action ensures that every supplement you take actually reaches your cells and provides the maximum support for your daily health and vitality. If you know someone over 50 who could benefit from this, share this video and subscribe for more simple health tips.